Good morning everyone. My name is Bhagyalakshmi, Professor in Department of Community Health Nursing. Today we are going to say an important topic in community health nursing. So the topic name is epidemiology. So let us see first the introduction of epidemiology. So epidemiology is nothing but it is the study of diseases among the human population. So mainly we are going to study about the disease patterns which is present in the human population. The diseases occurs mostly because of multiplicative factors. The main factors are because of host factors, because of agent factors, and also because of environmental factors. So these are the three main factors which are responsible for causing the diseases in the human population. Let us see about the meaning of epidemiology now. So epidemiology has been derived from a Greek word. So the epidemiology word has been used from the long centuries. So the meaning of epidemiology is epi is upon and demos means people. Epidemiology is nothing but the study of diseases among the human population. Next we'll see the definition of epidemiology. So epidemiology is the science of study about the diseases in human population, which is given by an author called Trushfield. We will see one more definition of epidemiology. Epidemiology is the study of distribution and determinants of health related states or events in a specific population and application of this study to control the health problem. So as we have discussed earlier, epidemiology is nothing but the study of diseases among the human population. So this definition is also clearly explains that we are going to see what are the etiological factors for the diseases and how we can able to diseases with the help of the epidemiological studies. Now we will move on to the aims of epidemiology. So the main aims of epidemiology is to determine the frequency and the distribution of diseases in a population. So what do you mean by this means? So the diseases are not same for the same age group people, and also it is not same in the same it is different in the different seasons. For example, we can see that in childhood, like upper respiratory infections are common, and when it comes to the adults as well as in the old age, so we can able to see many cardiac problems as well as diabetes or hypertension or some common disorders. As well as we can also see that the diseases are not common in males as well as in the females. So this point clearly explains that the frequency and the distribution of diseases in a population is different. The second point is to identify the etiology to achieve control over the diseases. Means for every diseases the causative factors are different. So we have to know what is the exact cause for causing the diseases. So then only we can able to control the diseases after identifying the causative factor for the particular disease. The third aim of epidemiology is to develop, plan and monitor the healthcare policies for the disease control program. So we can see many national health programs has come up because of many diseases has been seen from the past centuries. So because of this health diseases, so all the national health programs has been come up mainly to control the health problems among the human population. So next we will see about the scope of epidemiology. So the scope of epidemiology is very vast. So previously the scope was meant only for the infectious diseases because the infectious diseases are more in the past years, and now the scope of epidemiology has been expanding and has been enlarging because of the mortality and the morbidity status of the human population. And here we can see according to the disease group we have more than four types of epidemiology. So the one is infectious disease epidemiology, next cardiovascular epidemiology, cancer epidemiology and neuroepidemiology as well as other epidemiology also. The other classification of epidemiology we can see according to the group of factors. So according to the group of factors we have three types of epidemiology. One is nutritive epidemiology, which deals with the nutritional problems. The second one is reproductive epidemiology, so completely it deals with the reproductive system and what are the diseases happens because of the reproductive system. And the last one is because of environmental epidemiology. This epidemiology deals completely with the diseases agents which is present in the environment, which is the reason for causing many diseases in the human population. So I am going to conclude my topic. So today we have seen about the introduction of epidemiology, the meaning of epidemiology, the definition of epidemiology and aims, and finally the scope of epidemiology. Thank you students. Hope so you have understood today's topic, that is mainly epidemiology. Admissions are open for JNM, B.Sc as well as M.Sc Nursing in Athena Group of Institutions for the academic year of 2026 and 27. Thank you.